Stillbirth is the term used to describe the loss of a baby before or during delivery after the 28th week of pregnancy. It is a deeply emotional and traumatic experience for parents and families, and understanding its causes, risk factors, symptoms, diagnosis, and coping mechanisms can help those affected navigate this difficult situation. Causes of stillbirth. The exact cause of stillbirth is often unknown, but several factors and conditions have been associated with an increased risk. Placental issues. Placental abruption. The placenta detaches from the uterine wall before delivery, leading to insufficient oxygen and nutrients for the baby. Placenta previa. The placenta covers the cervix, potentially causing complications during delivery. Placental insufficiency. The placenta may not provide adequate blood flow and nutrients to the fetus. Infections. Certain infections in the mother during pregnancy, such as listeriosis, cytomegalovirus CMV, syphilis, and toxoplasmosis, can affect fetal development and lead to stillbirth. Maternal health conditions. Chronic health issues such as diabetes, hypertension, and autoimmune diseases can increase the risk of stillbirth. Poorly managed diabetes, in particular, can lead to complications affecting the fetus. Obesity. Higher body mass index BMI during pregnancy has been linked to an increased risk of stillbirth. Fetal abnormalities. Genetic or chromosomal abnormalities in the fetus can lead to stillbirth. These may include congenital defects or developmental issues. Multiple pregnancies. Pregnancies involving twins or multiples carry a higher risk of complications, including stillbirth. Lifestyle factors. Smoking. Maternal smoking during pregnancy is a significant risk factor for stillbirth. Substance abuse. Use of drugs or alcohol during pregnancy can negatively impact fetal health. Poor nutrition. Inadequate prenatal care and poor nutrition can contribute to fetal growth restriction and other complications. Advanced maternal age. Women over the age of 35 may have a higher risk of stillbirth due to age-related health issues and complications. Symptoms. In many cases, stillbirth is discovered during a routine prenatal checkup when a fetal heartbeat is not detected. However, some signs may indicate potential problems. Decreased fetal movement. A noticeable reduction in the baby's movements, particularly after the 28th week of pregnancy, can be concerning. Loss of pregnancy symptoms. Symptoms such as nausea or breast tenderness may decrease suddenly. Vaginal bleeding. Any significant vaginal bleeding during pregnancy should be evaluated immediately. Diagnosis. The diagnosis of stillbirth is generally confirmed through ultrasound. An ultrasound can determine the absence of fetal heart activity and assess the condition of the fetus and placenta. Fetal monitoring. If there are concerns about fetal movement or health, non-stress tests or biophysical profiles may be performed to monitor the baby's well-being. Laboratory tests. Blood tests may be conducted to assess maternal health, check for infections, or evaluate other conditions. Coping with stillbirth. Experiencing a stillbirth is profoundly distressing, and it is essential for parents and families to receive adequate support. Here are some strategies for coping. Seek support. Connecting with support groups, therapists, or counselors who specialize in grief and loss can provide emotional assistance during this difficult time. Talk about your experience. Sharing feelings with friends, family, or professionals can be therapeutic. Open conversations can help validate the parent's grief. Memorialize the baby. Creating a memorial or holding a ceremony in honor of the baby can provide a sense of closure and allow families to celebrate the brief life of their child. Take time to grieve. Grieving is a personal process that takes time. Allow yourself to feel the emotions that arise and seek professional help if needed. Consider future pregnancies. If contemplating future pregnancies, discussing with a healthcare provider about risks and preventive measures can help ease concerns and ensure proper care. Prevention and future pregnancies. While not all stillbirths can be prevented, Some steps can be taken to reduce the risk in future pregnancies. Prenatal care. Regular prenatal visits help monitor the health of both mother and baby and address any potential issues early. Manage health conditions. Effectively managing chronic conditions, such as diabetes or hypertension, is crucial for reducing risks. Healthy lifestyle choices. Maintaining the healthy diet, avoiding smoking and alcohol, and managing stress can positively impact pregnancy outcomes. Monitor fetal movement. Being aware of and monitoring fetal movements in the third trimester can help identify potential issues early. Vaccinations. Staying up to date on vaccinations, e.g., flu vaccine, Tdap, can help protect the mother and baby from infections. Conclusion. Stillbirth is a tragic event that affects many families. Understanding its potential causes, recognizing symptoms, and knowing how to seek support can help parents cope with the loss. If you're someone you know is struggling with the aftermath of stillbirth, reaching out for professional help and connecting with others who have experienced similar losses can be invaluable in the healing process.